have a doctor in the house, and I have an ex-nurse, old nurse, but now she's a television presenter, presenter of what's the name?
Metro TV.
No, the show. F2Semo. So I will be talking to them, and what we will talk about, we're just looking at the attitude of doctors and nurses towards their patients in the hospital. A lot of cases full ground well, and big doctors say, hey, look, as I come now, they can't lecture the people, both nurses and both patients, and then the doctors and then the nurses themselves. Doctor, I'm going directly to you. Introduce yourself, talk for me and for our listeners.
I'm Dr. Nketia.
Dr. Nketia, you there at Kolebo Hospital or where you there?
Exactly.
Wow. I like the Kolebo Hospital because inside the Kolebo Hospital now a lot of matter they happen. I'm happy say you come up from there, come here. I hope you are ready for us.
Yeah.
Hey! The way they look me like this, I go ask you all the questions you don't expect to. Hello, our mama Korea. From F2 Metro TV. That be the woman where they sit down, they knock you, go to talk about plenty matter. Now nurse too, where the woman be. So today they come talk on behalf of nurses. Let me go directly. Mama, I'm going to hear your voice a little bit, introduce yourself, and then we'll go fire.
Yeah. I am Mami Korea.
Yes.
I'm with Metro TV.
Yeah.
I do programs on Mondays.
Okay.
6 p.m. to 7 p.m.
6 to 7 p.m. definitely. And we are ready to talk for nurses today.
And it's been repeated every Tuesday.
Oh, okay.
9 a.m. to 10.
No, wahala. Are you ready to talk for nurses today?
Oh, sure.
Okay. All right, doctor. We're going directly first. I want to know how. Don't bother about my pidgin English. If you don't understand, ask me a question. You understand? But you can use good English, a clean one to talk. You understand?
Yes.
Or should I use a clean one to ask you a question? Will you understand the pidgin?
That's okay.
Yeah, I want Sabi, how did they take recruiting into school? Because when you look at the attitude of some doctors of late, sometimes you begin to wonder, this one they go through training before, how did they take recruiting into school? Is it by qualification or by connection? Maybe my papa na minister, then papa you go push my head inside the school.
Well, I think for the medical profession as doctors, it's one of the strictest areas, and recruitment, as you said, is also quite strict. It's not only qualification.
Okay.
You really have to study to make your points and your grades.
Wow.
But you also have to at least go to an interview. You meet panels who will interview you.
Okay.
And you also go through a disciplined training at school, which is supposed to shape you to be that professional that you ought to be.
Okay. Wow. Mama Korea. Now, so how they take recruit nurses?
As for with the nurses,
yeah,
you have to get your certificate with the BSc.
Okay.
Before we call it secondary school.
Okay.
And it needs some required passes.
Okay. Wow.
Wow.
Before
you sit an exam again.
Okay.
And if you get the required pass mark, then you start with the training.
Wow. You know why I'm asking about that of the nurses also? Because sometimes you go to hospital, you are speaking English, and the nurse is busy firing through. You understand? So you begin to think, this one will be no good school. You understand? No, so, oh, nurse, please, I am, content. You understand? So I'm happy to hear that they recruit them and they need to pass certain courses before they go do their job. You can see that a lot of patients are really going through so many wahala, and some, for example, let me take my case, this one not be say go come, my case, my first child, she's 12 years now. When I gave birth to her, at Kolebo here, and when I was in labor, got to the hospital, they took me in, and even then the nurses were like, come on, time and year, Sue, you understand, that's your time, it's not yet time. I said, hey, but the labor, and they feel something, they come, then they are shouting, why, and then we go sit down, lie down there, the child is coming and they are busy watching television, chewing granite, chatting. So the person who actually came to my aid was these people where they clean these cleaners, those ones wearing red check. Now that woman went into the room, and she looked. They realized the child had come, and she was shouting, "Hey, Kodana Bao," you know. And they ran. She actually came, brought something, carried me in with the child, took, and started trying her best. So you push, because it didn't come out finally, fully. Push. The child came. After that, I think it was when she was about to cut the umbilical cord, she couldn't. That she now went to them, and then one of them came. And I realized that this is how some patients have been dying. This is how, before you say, Jack, a patient is dead, and the nurse is there watching television, watching, a Jacko, I'm happy you've been a nurse, Why are some nurses, not all, why are some like that? What is it a demon or is just total wickedness? Yes, over to you.
Nowadays a lot of nursing school have sprung up. Everybody is opening nursing homes to train the girls.
Exactly.
It's because the big hospitals are full.
Yes.
So if she looks around and there isn't any job for her, and this nursing school is recruiting, she will just go with her certificates. And some of them even don't scrutinize the certificate very well. They just need money. So they will recruit her and train her to be a nurse. I'm sorry to say this because you are talking about yourself and your sister.
Yes. And there are other issues, a lot of cases. If I open phone line now, you will hear a lot of experiences.
I have several examples to give. My colleagues or contemporaries just went on retirement with the police hospital.
Okay.
And I went there as a former nurse.
Okay.
And nobody took recognition of me. We opened police hospital in 1976. You see? So the attitude, one is home training.
Okay.
And secondly, it is the calling.
Okay.
There are very good nurses. I can mention their names here.
Wow.
So dedicated.
Okay.
But they are, you can count them with your fingertips. And most of them don't have the call.
Wow.
It's just like priesthood.
Okay.
If God has not called you,
yes,
and you want to force yourself to be a preacher or an evangelist or whatever, it will come to a stage that people will know the true color of you. I have been a nurse. Nowadays, I was telling doctor that I don't feel like going to hospital. And he did not ask me why. I am so scared of them.
I have to tell you, scared of a nurse.
I am so scared of them.
My goodness.
I mean, the way they will snap shoot you from head to toe. And it demoralizes you. I told you, I haven't been to hospital since 2007. I have been self-medicating. I'm sorry to say this, because of the attitude.
But doctor, do patients have any way to report when they go through this type of, is there anything like that set up for, let's say, patients?
I also want to, say a little bit about what
Mama Korea said.
I think that, with all fairness, I think that there are a lot of challenges at the hospitals.
Okay.
And probably, and most of it, the demand of patients are not met.
Okay.
Lots of challenges. If you go to a hospital, 100 patients, probably a few doctors around to see.
Okay.
And of course, not all of them could be seen at the same time. And as I said, they are trying, and those who need to be seen always are seen.
Okay.
That alone sometimes brings problems. Why is this patient being pushed in?
Okay.
They've taken some money from this patient.
Okay.
But we know what we are doing. We are professionals, and as I said, we do what we ought to do.
Okay.
But with the attitude, I think that if every hospital will have administration, and if there are issues that you think that you've not been fairly been seen to, you can go to administration, probably make a complaint. And I'm sure in those situations the administrators are there to help. They also can call the doctor or the nurse and see probably what ensued and try to.
Wow, I love this one. I'm so happy to hear that, because I've never had any patient go to report before. Sometimes it's so sad. All you need to do is just to cry and go home. It's so
Mama,
so sad.
I have worked in Nigeria.
Yes.
I worked with St. Nicholas's Hospital.
Okay.
With Dr. Maje Kudumi.
Okay.
Over there was a suggestion box that every weekend the doctor will go in to pick what is written there.
Okay.
And if it affects you, instantly he will dismiss you.
Wow.
Yes. St. Nicholas's Hospital at Marina. You know. So when I worked with him,
okay,
that discipline was instilled in me.
All right.
I get scared going near a patient. Hey, because you don't know who the person is.
It's okay.
You know, it's just unfortunate that I'm exposing my people.
Oh no, Abba.
But it's not proper that you should know who the person is before you render courtesy.
Loaded Mama, she's back on your way.